Hi class, it's Dr. Lindner. What we're going to talk about in this video is the stomach. So let's just review a few key structures here. We see the esophagus. The esophagus is going to allow bolus from the mouth to enter into the stomach. And there is a valve right in here called or a sphincter, called the lower esophageal sphincter, also known as the cardiac sphincter. The top of the stomach here, this section is referred to as the fundus, and this section here is referred to as the cardia. The curvature on the inside is called the lesser curvature of the stomach. And then on the outer portion is the greater curvature of the stomach. Let's review the three layers of musculature. There's the longitudinal muscular layer, there's the circular muscle layer, and then there's the oblique, right? So we could see the oblique going this way, obliquely, circular, making a circle around the entire stomach, and then we have longitudinal, okay? The bottom portion of the stomach right here is called the pyloric region. And then right here is the pyloric sphincter. When the pyloric sphincter opens a little bit, it allows some of the food to enter into the first part of the small intestine, referred to as the duodenum. Notice inside the stomach is a region called the rugae. The rugae. The rugae give a little bit of room for the stomach to expand, but I also kind of refer to it as like a second set of teeth, so that when these three muscular layers contract, it helps to churn some of that leftover chyme that's in the stomach. Remember, when bolus enters the stomach, when it mixes in with all the gastric juices, it's referred to as chyme. In the stomach, the pH is around 2 to 2.3, so it's very acidic due to the hydrochloric acid that's in there, right? The hydrochloric acid is made by the parietal cells along with intrinsic factor, and then the chief cells produce pepsinogen, and the pepsinogen gets converted into pepsin to break down proteins, but the conversion into pepsin is from hydrochloric acid, right? The hydrochloric acid knocks off the ogen, it activates pepsinogen into pepsin. And the P in pepsin for protein, it breaks down the protein. The parietal cells also make intrinsic factor, and intrinsic factor in an acidic environment binds to B12, and intrinsic factor transports B12 right out of that stomach, and eventually it has to make it into the ileocecal region for its final destination for absorption. So we really want to have a good degree of acidity in the stomach, but a good degree of mucus to protect the lining of the stomach. So the stomach is going to hold the ingested food. It's going to degrade the food both physically and chemically. Physically, because of those three layers of muscles, and chemically from the digestive enzymes, especially the hydrochloric acid. The stomach will deliver the chyme into the duodenum and enzymatically digest proteins with pepsin. The stomach secretes intrinsic factor because of the parietal cells, which is required for the absorption of B12. So B12 plus intrinsic factor, and this binding of B12 to intrinsic factor only happens when there's an acidic environment in the stomach. So what happens if someone uses antacids because they have heartburn? Then they raise the pH of the stomach. They don't get to absorb B12. There's also an issue with calcium absorption. And then there's also a problem with iron absorption due to antacids. You need an acidic environment to absorb iron, calcium, and B12. Short term, probably not a problem, but long term use of these proton pump inhibitors or H2 blockers, it is certainly an issue. Okay, in terms of food storage and optimization of digestion and prevention of uh, poison ingestion, what this is saying here is that within the stomach here, let's see if we go back here, the pyloric sphincter can open a little bit to release certain contents into the duodenum. And if the contents are healthy and seemed safe, then the pyloric valve or sphincter opens more, releasing those contents. If it was berries and the berries were safe, then it opens up and enters the duodenum for absorption of all the nutrients. But if it opens up a little bit into the duodenum and the innate intelligence says, oh, this ain't good, then it shuts and then reverse peristalsis happens and it allows for vomiting. Okay, so what happens with alcohol? Right now, alcohol is absorbed directly through the lining of the stomach. As the person consumes more alcohol and their serum alcohol level approaches toxic levels, their innate intelligence, the body assumes that only a small amount of alcohol has been absorbed into the bloodstream through the small intestine, and that the majority of the alcohol is still present in the stomach. So the body will try to vomit out all the alcohol that's in the stomach, but it's already been absorbed in the bloodstream. So what happens? They just have these dry heaves and nothing comes out. In terms of cancer of the stomach, when we hear about cancers, it's an accelerated growth of abnormal epithelial tissue, whether it's of the stomach, whether it's of the esophagus, whether it's of the colon. It's always an accelerated growth of abnormal epithelial. And the causes of cancer of the stomach is going to be the causes of cancer of the esophagus and causes of cancer of the intestines, colon. There's overlap to the entire GI. But we see smoking and alcohol as like the number one for cancer of the stomach, cancer of the esophagus, cancer of the pancreas, smoking and alcohol. Gastroesophageal reflux disease that's chronic, spicy foods, pickled foods, salt cured foods, fried foods, smoked foods, deficiency in certain minerals like zinc and molybdenum and vitamin A. Here, smoking in, and then an unhealthy balance of good and bad bacteria. So getting dysbiosis can be a major cause. Some of the symptoms of gastric cancer is going to be weight loss of 10 to 15 pounds in half a month or 30 pounds in a full month. And they have this aversion to animal products. You know, they go to the supermarket, they're walking by the section where the meat is, and either the look of it or the smell of it makes them nauseous. There's stomach pain, but then there's also back pain. And this is something that's really important for those getting involved in manual medicine or physical medicine, physical therapy assistant, occupational therapy, chiropractic. Um, when sometimes when the symptoms appear to be musculoskeletal in origin, the problem can be visceral or organic. And that's just something to keep in mind. There's hematemesis, which is vomit that contains partially digested blood, and it appears to have the appearance of coffee grinds in vomit. And then there's jaundice. If you're light skinned, you can see jaundice in the skin, like yellowing of the skin. If you're dark complexion, you can use the white of the eyes. The sclera will appear to be yellow. And the therapy is typically a partial or a total gastrectomy, or they'll do radiation and chemo for stomach cancer. Now, what else is common of the stomach? Hiatal hernia is where you get this protrusion of the stomach through the diaphragm. So here's the diaphragm, and in both of these, we're seeing the stomach protrude upwards. Part of the stomach is up here, and what's the problem with that? Well, the stomach has these parietal cells that produce hydrochloric acid. And the environment of the stomach, with a lot of its mucosal neck cells, can produce mucus to protect the lining of the stomach, but the esophagus isn't quite designed the same way to handle the acidity. So you can get this redness or this burning sensation, um, and they refer to that as heartburn. So, oftentimes they'll end up using these proton pump inhibitors or H2 blockers. Uh, Remember, hydrogen is a proton. So if you use a proton pump inhibitor, you're blocking the amount of hydrogen. So you start to lose acidity. The more hydrogens, the more acidic. Some of the symptoms are going to be gastroesophageal reflux disease, pain behind the sternum, and back pain, as well as dysphagia. Dysphagia means difficulty in swallowing. Not dysphagia with an S. If it's dysphagia with an S, it's difficulty in speaking and communicating. Dysphagia with a G is difficulty in swallowing. So the causes of hiatal hernias: heavy lifting, obesity, pregnancy, people that wear tight-fitting clothing. Those are probably some of the biggies for hiatal hernias. And oftentimes there's a congenital cause. The therapies are typically avoid the causes of cancer of the esophagus. You can invert the bed without pillows, avoid heavy lifting, don't wear tight clothing, decrease a weight because obesity is a cause. And when you're eating, it's important to decrease the size of the meals, but increase the number of meals, just decrease the size. When we talk about ulcers, stomach ulcers, sometimes they'll use the word gastric ulcer or peptic ulcers, but peptic ulcers can occur in the stomach, the esophagus, and even the small intestine. So it's when there is an erosion or a break in that protective mucosal lining of the esophagus, stomach, or the duodenum. And occurs equally in men and women between the ages of 55 or 65. The ulcer generally occurs when the secretion of the hydrochloric acid and the pepsin in the stomach is greater than the secretion of the mucus. So remember, the mucus that lines the stomach is going to protect it. And prostaglandins are also a hormone that's responsible for the production of mucus. So if you block prostaglandins or use prostaglandin blockers, like some of the painkillers or aspirin, what happens if someone takes too much aspirin? They block the mucus production. They end up with the same amount of hydrochloric acid, and now you don't have the mucus protecting the stomach, so you get an ulcer. And the stomach starts to digest itself. And when it digests itself, that's what we cause an ulcer. Some of the other causes are smoking, alcohol consumption, caffeine, stress. Oftentimes what I end up seeing around many of our local hospitals where I live, we'll see a lot of healthcare practitioners overworked, under a lot of stress. They're outside on a smoke break, also drinking coffee. 3 triggers causing these ulcers while they're under lots of stress. It's important, we hear about this brain-gut connection. And one of the things that I want to show you is actually where this brain-gut connection takes place. But we often hear of people who are anxious or nervous, When they're anxious and nervous, they're running to the bathroom all the time. When they are depressed, they're constipated. And sometimes this has a lot to do with the neurotransmitter serotonin. We have cells called enterochromaffin cells that produce serotonin. And we have at least 7 different types of serotonin receptors in the gastrointestinal tract. It's not just within the brain, it's throughout the GI tract. When stimulated by serotonin, these receptors communicate with nerves that control digestive enzyme secretions and gastrointestinal motility. So oftentimes when there's a serotonin imbalance, there's going to be irritable bowel disease or irritable bowel syndrome due to imbalances to the serotonin. Now, here's a great picture of the brain-gut connection. So what we're looking at right here is the intestinal epithelium. Down here is the lumen, where food and bacteria lie. And then I want you to see this vagal nerve right here with the up and down arrow, because there are afferents going up to the brain and efferents going down. So it's a two-way street sending signals to the brain and from the brain, up and back and forth, back and forth. But I want you to see stress coming into the body. Now, stress is a term in which the body has trouble differentiating between physical, emotional, and chemical stress and thermal stress. The body can't differentiate it. Stress is stress. The stress is going to signal the hypothalamus, which signals the pituitary, which signals the adrenal. When we did endocrinology, we referred to it as the HPA axis, the hypothalamic pituitary adrenal axis. And then there's a hypothalamic pituitary thyroid axis. And I hope you make the time to go to my YouTube channel and look at one of my videos that talks about the HPA and the HPT axis, how stress from the hypothalamic pituitary adrenal axis can downregulate and create a hypoactive thyroid. Anyway, stress comes in and it goes to the outer part of the adrenal gland where you have the cortex. On the inside is the medulla, and the adrenal cortex makes these glucocorticoids. Cortisol, cortisone, corticosterone, these are all glucocorticoids. And the cortisol production creates this permeability. It creates damage to the epithelial lining, creating what's called a leaky gut, also known as intestinal permeability. And this allows bacteria to ride up that vagal nerve, and many of the bacteria migration is pro-inflammatory. And this creates inflammation. Now, you can have good bacteria creating good cytokines, and you can have bad bacteria creating bad cytokines. So as you see down here, good prebiotics and good probiotics, short chain fatty acids, butyrate, propionate, right? So these short chain fatty acids are very, very good for those tight junctions, and glutamine and zinc and vitamin A, they all help to heal the epithelium. But the good bacteria can create these anti-inflammatory cytokines. Those anti-inflammatory cytokines can reduce the pro-inflammatory cytokines. Okay, so just a little visual aid to support and help show the brain-gut axis, the importance of keeping and putting in good probiotics into the system, being very, very careful with antibiotics, right, that destroy the bacteria. But also, when I say stress, it's physical, emotional, and chemical. So this could be herbicides, fungicides, pesticides, food coloring, food allergies, things that you're allergic to. And oftentimes it's healthy food. Some people say, I don't want to have cow's milk, I'm going to have almond milk. And then they're allergic to almonds and don't know, and it creates these issues, skin rashes, dilated pupils, headaches, irritable bowel. Okay, so an antigenic load is stressful to the body. Anything that you put in that your body doesn't like is stress. Thoughts can be stressful. Your thoughts can change the microbiome. Okay, what is your mood after the food? You have to ask yourself. Okay. All right, H. pylori, this is something else that maybe you've heard of before. There are some healthcare professionals that believe that an infection with a type of bacteria known as H. pylori can cause an ulcer. Okay, and this is one of those instances where is it cause or is there an association? You know, at every fire that I've been to, I see firefighters. Do I say that firefighters are causing these fires? Ridiculous, right? Silly. But, or is there an association? Because there are some recent studies that have suggested that the overgrowth of H. pylori in the stomach may be the result of the ulcer and not really a cause. Because H. pylori can produce chemical substances that are similar to antibiotics that appear to protect the GI tract against other pathogens. They produce urease, which converts urea into ammonia. And ammonia is what neutralizes the acidity of the stomach. Just food for thought. And patients who experience pain is the most common clinical symptom. The pain with gastric ulcers are usually when the stomach is empty. Okay, it's not after they eat. The pain is typically before. It's pretty sharp. It's a burning type of pain, not only in the abdomen, but also in the back. That's often alleviated by the ingestion of something bland. Okay, it can relieve it temporarily. The stomach ulcers are usually more severe than duodenal ulcers, and patients often experience more hematemesis, which is the vomiting of blood, GERD, gastroesophageal reflux disease, anorexia, and weight loss. Here's a great visual showing the mucosa. You start to get a little bit of an erosion through that. And as it gets deeper and deeper, it's obviously going to become more severe and much more painful as it goes through the other layers. And it's also more vascular the deeper it gets. Here's a gastric ulcer, here's an esophageal ulcer, and here's a duodenal ulcer. Here again are gastric ulcers. So what's the therapy? If it's stress, reduce the stress, avoid all the causes of cancer of the esophagus. Carrot and cabbage juice, very, very beneficial. There's a substance that they refer to as substance U, the U for unknown, but they believe the unknown now is glutamine. And glutamine is a very, very important amino acid that's very healing to the intestinal permeability. Very, very healing. Aloe vera juice is very helpful, deglycerized licorice. And if that doesn't work, then there's a last resort of surgery to remove the area of the stomach that has the ulcer. Because the stomach is made up of epithelium, it does take a little bit of time to heal, 4 to 6 weeks. What is typically used, again, those proton pump inhibitors to try and decrease the amount of acidity, or they use H2 histamine, H2 blockers. But again, you want to be careful when playing around with the pH because remember we have 0 to 14 and we have neutral, which is 7. Blood is somewhere over here, right? 7.4 is blood pH. We're looking at the pH scale here, percentage hydrogen or potential hydrogen. And then right here at around 2.3 or 2.0, somewhere around there, is the acidity of the stomach. And when we use, or an individual uses antacids, they're trying to increase the pH, right? They're trying to change the acidity, make it more alkaline or basic, because the acidity is what's doing the damage. But think of the downstream effects of that. If you don't have the acidity, how do you convert pepsinogen into pepsin? So is this person going to have difficulty breaking down protein? Yes. And then the protein breaks down to amino acids. These proteins are needed for muscle mass, for bone mass, for neurotransmitter production. These proteins are needed for so much within the human body. If you can't break down your proteins, now what about the acidity in relationship to B12 and intrinsic factor? Think about that. If you can't absorb B12 properly, then there's going to be methylation issues, perhaps. You could review a video that I have on methylation involving B6, B9, and B12. What happens if you don't have the acidity? What's going to happen to calcium absorption? What's going to happen to iron absorption? What's going to happen to the natural microbiome of the stomach? Just food for thought, things to think about. So whenever using these proton pump inhibitors or antacids, it really should be for a short term to allow the lining and the lumen of the stomach or the esophagus to properly heal. But it should not be a long-term solution. Just because these things like Tums are over the counter, it doesn't mean that they are safe. So be very, very careful. Okay, when we come back, we'll get into the small intestine.